A very good afternoon from ICM Munich, where the 25th International AIDS Conference is taking place. And we are really honored to have with us today Eamon Murphy, UNAIDS Regional Director for Eastern Europe and Central Asia and for Asia Pacific. Welcome, Eamon.
Thanks very much, Shobha. I'm very pleased to be with you.
You are wearing two heavy hats as you lead UNAIDS as the Regional Director for two regions, Eastern Europe and Central Asia, as well as Asia Pacific regions. Eamon, if we look closely in these regions, what does the latest 2024 UNAIDS Global AIDS update tell us about them?
The update tells us that in the two regions we have different trajectories. We talk about AIDS at a crossroad, and we're talking about which pathway to take. If I take the regions separately, in Eastern Europe and Central Asia, we have a 34% increase in the death rate from HIV today. That's what our report is showing. From the data from the countries, it's not our data, it's the countries' data. And yet in every other region, including in Asia Pacific, we have a decline in the death rate. In our region of Asia Pacific, 51% decline. And that's the global average. So what's going wrong on access to treatment and adherence to treatment? That's one example. The infection levels. In Asia Pacific, last year, I would have said we had a 14% decline. This year, it's a 13% decline. So we're actually going up slightly. It's stagnating. That's a real challenge. We have such big numbers in our region, the second largest epidemic in the world after East and Southern Africa. So if we're not going the right way, and they have a serious, significant and successful decline in new infections. In Eastern Europe and Central Asia, we have rising infections, a 20% increase over the same time. So at least we have a decrease in Asia Pacific, but we have an increase in Eastern Europe and Central Asia.
Okay. Can you share on the HIV responses in these regions or sub-regions, as we may call them? What has gone well? What could have been done better? What are the gaps? I think it's a loaded question, but we will get the correct answer from you.
It's a loaded question, but and it's a difficult one to answer because a lot of it's at country level. And where we've seen strong investment by governments, working with the partnership with the community and science, we've seen great success. And so in Asia Pacific, we've got quite a number of countries going the right way. But we've also got a plateauing, a reduction in that political leadership and commitment. That's the big challenge. And we need to re-energize that across some of our big epidemics. And by that, I mean big number epidemics in our region, where we've got the right mix. We've had leadership from these countries in showing the rest of the world how to do it. But now the rest of the world's doing better than them. In Eastern Europe and Central Asia, we actually don't have enough commitment from governments to provide the right level of testing and the right level of prevention and treatment services. And the right mix. We also have laws in both regions that are holding us back. And they are actively used in some of the countries in Eastern Europe and Central Asia to stop people, in a way, from coming to testing or treatment because they criminalize the potential risk or the transmission of HIV. In Asia Pacific, we have these laws in some places as well, but we also have a whole range of criminalization of people by who they are, their work, or their behaviors. This has to stop. This has to go. It's not just for HIV.
You have mentioned these challenges. Do you foresee that they will come down, or how to overcome them? Particularly, is it the government and political leaders' role in it?
Well, at the same time as we have these challenges and some countries taking the wrong path, we've got countries taking the right path. If in Asia Pacific we've got countries that are treating more than 80% of the people living with HIV, like Cambodia, Nepal, New Zealand, Thailand, very different countries, right? They are showing the way to do it. In Nepal, they've also reduced new infections by more than 75%. And could quite easily reach the 90% target. So there we know it can be done. So what does that mean for the other countries? They're not investing in the right programs at the right time for the right people. or else they have legal barriers and legislative frameworks that are keeping people out of services. We've got the Philippines, where we have rising infections, significantly rising, over 500%. We also have a very high death rate, so it's not working. And yet the government's trying hard, but they're doing a catch-up because they didn't maintain programs early. So we need to see that. In Eastern Europe and Central Asia, we have a mix of issues here. So we have countries that are doing really well. Armenia is investing and paying for 97% of the treatment for people. So we've got examples in the region. Yet at the same time, we've got countries enacting laws that are making people afraid to go near a health service. So if they've got HIV, they're going to be extremely unwell and at risk of transmitting it to other people because they're too afraid because of the new laws that have been brought in.
Iman, we personally feel that the UNAIDS target setting for 90-99-10, 95-95-95 is brilliant, and it has helped people relate to the care cascade, also grounded in the U equals U principle. What about the 5-5-5 that are left out? I think that is probably the last mile, which is the most difficult mile to reach. So how do we work there?
Well, Shobha, first I think we need to get people to the 90, right? And the 95 targets. Yeah. We've still got a long way to go for quite a number of the countries. But you mentioned U equals U. Yeah. That is a serious, there are two elements at this conference that we are talking about constantly. U equals U, where we know now the science is clear. If people are able to access treatment and remain on their treatment, they achieve viral suppression. They do. The people taking the medicines can achieve viral suppression. And the World Health Organization has confirmed there will be zero transmission sexually. So what does that mean for them? They can have a normal life like anyone else, have children, normal family life. That's a powerful tool, both for why we need to get people into testing early, into treatment, why they should take themselves into treatment services and be supported to stay there. But it's also a way to show the community HIV isn't what they think it is, what they thought it was 30 years ago. It's not a death sentence. They don't need to be afraid of people who are living with HIV, and they should support people living with HIV to access services or people at risk of HIV. So that will help us get to the 90s, the 95s, and those 5s and 10s. So the other part, I would say, is investment in the new technologies, the long-acting injectables, both for treatment and prevention. They're significant game changers, but as you know from the conference, Shobha, the price is way too high currently. But we also saw the modelling and the science showing they can be produced for as little as $40 a year. Now think of the savings governments can make if they invest in that type of technology, because then you don't need someone constantly coming into your clinic. You save on the resources there that can be redirected to other health issues, and their health is stronger. They won't transmit HIV, or if they're taking it as prevention, once every 6 months is very different to having to take a pill a day. So these are significant game changers. But it's the three areas of sustainability: political commitment, and that means a renewed commitment or a re-energized commitment in many of our countries. The right programmatic mix, not old-fashioned programs for a different time and a different epidemic, but what's happening today. 47% infection levels in a number of countries, Thailand, Indonesia, Laos, Cambodia, Myanmar, of young people under 24. So that means we're going to have programs tooled for the young as well, and not the old epidemics. And then we can actually achieve it. But that would also mean governments investing more resources in these new, more effective ways of combating HIV.
Thank you. You're very right, Imran, and also that brings to my mind the tools which we have. You talked of lenacapavir. It means we are hoping it will be a miracle once it is approved, once we get the purpose to trial results. But the existing tools which we have, the existing options which we have, even they are not reaching the people, and sometimes I feel that science is giving us 100%, but what science gives us is reaching 0% of the people who are actually in need of it. Women and girls, again, those who took part in that study. So what is the way out to make sure that the labors of science are transformed into public health gains quickly, and not every time we don't have to wait for that long.
Yes, maybe I've been working too long in public health. I started in Australia more than 30 years ago on communicable diseases. But what tires me is when I hear government after government talk about piloting something that's successful elsewhere in their own region. Don't compare it to some developed system somewhere. When countries in our region are already implementing at fairly effective scale, why do you need to pilot with a few people? Just move on it. And we know the science is there, and experts in their own countries know the science works. So policymakers need to be bold and really take action, and they can quickly bring epidemic numbers down and show success for their political leaders, because political leaders like to see success. That's an important part of it. But if we're slowly looking at these and over-analysing, it's the same with testing. We have new approaches to testing. That's self-testing, that's community-based testing, rapid tests, but we've got some countries wanting old-fashioned confirmatory testing, and you lose the patient along the way. The person doesn't want to wait a month to get results. So we really need to reform the system, and these are lessons for other diseases. It's not just for HIV. And so we can really shift that. So policy makers need to put the right programs in place and move that. And then the resources can flow. If you can show the impact and the financial cost effectiveness of it, that will influence the political leadership. And so I don't know why we're seeing this stalling and this fatigue, but we really need to get behind this, because this is people's lives. In our new report, and you'll see in the data we presented at the regional launch, we talk about the numbers of people who are dying every day or becoming infected every day in our region. In this day and age, Asia Pacific was at the forefront of the response to HIV at the beginning. It's been well overtaken by other regions of the world and other countries. Eastern Europe, Central Asia has a big catch-up to go. There are 4 countries in particular that cover 93% of the new infections. So they really need to shift and change their approaches to catch up and get the programs on the right path. Because right now we're at a crossroads and we're going the wrong direction in a number of countries and not the right direction that other countries are following. Thank you.
Any closing remark to sum up?
We can end AIDS as a public health by 2030. We have countries in our world that will achieve that, and that's countries like Botswana, for instance. So we're not talking those with lots of resources. We're talking all different types of countries that are either achieving some of the targets or soon all of the targets, but others are way behind it. So it doesn't mean there is a real reason why we can't all achieve it. It means political leadership. It means the right programs with the resourcing put behind it by governments for the people. Everyone has a right to health and full enjoyment of their lives and contribute to society. We can do it.
Thank you very much, Iman, for finding time to speak with CNS and energizing us with hope, because without hope, we cannot achieve.
Absolutely. And thank you, CNS, for the great work you do in sharing the information across communicable diseases, tuberculosis, HIV. We need to work together more on these issues.
Yes, thank you very much.